Good morning, Jony. Congratulations on winning one of the top abstract prizes for UEG 2018. Can you just tell us a little bit about the issues of performing surgery on the pancreas?
Thank you for your congratulations. So my PhD is on laparoscopic surgery for pancreatic surgery, and in the last few years we have tried to safely implement this new technique in pancreatic surgery, whereas in other gastrointestinal types of surgery it's already much more normal practice. So we've performed a nationwide training program and followed this up with a randomized controlled trials to actually compare both techniques. While pancreatic surgery in general is already considered as a difficult type of surgery, when you do it with laparoscopy, this makes it even more difficult. So therefore we were really aiming on safely implementing this technique.
And what do you think the implications might be of this research project for patients?
Well, we aimed at, or you can hypothesize that laparoscopic surgery, well, you make smaller incisions, could therefore patients could have less pain and therefore recover faster. That's actually our main aim, to improve postoperative recovery for patients.
Mm-hmm. And do you think the research has any implications for training of surgeons in the future?
Yeah, well, despite our aims to safely implement this technique, and which we saw actually good results of doing this type of surgery for pancreatic tail resections, in the trial which I will present today for the pancreatic head resections, we did not see a benefit for patients. So therefore we do think that the results of this last specific type of research will have implications for surgical training, whereas at the moment in the Netherlands we are not performing this procedure anymore, which is a consequence of the results of this trial. We think that this will maybe enhance further training programs and more extensive training programs where we implementing new surgical techniques.
Okay. And what are the next steps for this particular research project?
So, as mentioned, now we don't perform this type of surgery anymore, but of course robot-assisted surgery is becoming more and more popular, and that could be an alternative with maybe some other benefits than laparoscopy, or maybe easier to train, so that's a possibility. And we're also still looking at if and how we could maybe reintroduce laparoscopic surgery for pancreatic head resection, whereas for the tail resections we are still performing this procedure and actually expanding the indications. So that will be the things that we will going to look at in the next years.
And what does winning this award mean for you personally?
Well, it's of course an honor to be here and to win this prize, and it also gives us the opportunity to go on with this research, especially in a time where it's a little bit difficult and where you find results that you did not expect on forehand. The prize will maybe able us to start a registry in whole Europe to see how other countries and centers are doing this, and to maybe even improve patient safety. Or at least to make sure that patients are not hampered by introducing this new technique.
And from your own experience, do you have any sort of advice for the next generation of researchers?
Well, at least I got the opportunity to always travel a lot and go to a lot of conferences, and I think that would be my advice for other researchers, to also try to talk to as much as to much other specialties, but also other people from other countries to try to expand your research on an international level, which I think I would advise.
Good advice, and congratulations again. Thank you very much.
Thank you.